the US spends more than 1.5 times the second highest spending country in the world. And at the same time, we have, fewer doctor visits per capita. We have shorter average length of stay in the hospital, fewer hospital beds, and a lower occupancy rate of those hospital beds. And so from the employer's perspective, then they know how much each employee costs them, and they have to make some choices. Do we hire more people, or do we staff at a minimum? Do we pay people in health insurance, or do we pay them in US dollars?
First, the employer can try to reduce the cost either by narrowing the network or simply reducing coverage. Second, the cost can shift from employers to employees. And the third way is to keep the current benefit, pay the higher cost, and have less money for other things like wages and other benefits like retirement or training.
And so some of the most effective things that I've seen are cutting out the very high priced providers, which very few have done, or in some cases, direct contracting, where employers have formed a relationship directly with a healthcare provider, not working through a health insurance company or a third-party administrator. And they have a conversation about what it is that they both want and need. And in some cases, they're able to, either for the same price or a lower price, have a better patient experience and a more of a focused program that meets the needs of employees.
So what happened in Montana? When I took over the state health plan, we were projected to have minus 9 million in reserves in 2017. But instead, we ended up with 112 million positive. The legislature did pass a bill in 2015 that said pay raises were dependent on turning the health plan around. No pay raises until that health plan was turned around, and no additional funding from the legislature. So I needed to gain legislative support. And as you can imagine, and all the speakers have said this, the lobbying effort from the insurance companies and the hospitals was really against me. But to bring the legislature on board, we talked about what could $25 million do for Montana, because I knew I could have that pulled out of the health system and back in the reserves, minimum of that, before 2017. It could retain jobs, it could build roads. Now, these are things important in Montana. It could support Medicaid enrollees, it could educate students, and even more than that, it could produce pay raises for the state employees. As a result, the legislature came along and did pass legislation in 2017 and again in 2021 to pull money back from the health plan reserves into the general fund, because the health plan reserves had more than the Montana general fund. And even better, there were no health plan rate increases in 2017 clear through 2023. There have been enhanced benefits, and there have been pay raises for the state employees.
Hospitals will fight fiercely to maintain their very profitable status quo. And they will pull out all the arguments we've heard today about the cost of uncompensated care, shortfalls in Medicare and Medicaid, the impact of COVID, and they are very, very convincing. So to succeed, you have to constantly stay one step ahead of these arguments using very solid data and analytics, so that it is just a question of data and analytics and not personal, if you will.